It's a great pleasure to come to you today and talk about some very important issues. I'd like to thank everybody that follows my videos on this YouTube channel, Venous Resource Center. Encourage all of you to sign up for it. If this is your first time, this site is dedicated to providing important everyday information for people to use in their healthcare, and also as particularly important during this COVID-19 pandemic. I'd like to acknowledge Dr. Hassan Sadaldan, who helps me with the preparation and distribution of these videos. I would also like to acknowledge Dr. Alfonso Tafur, who is a brilliant vascular medicine specialist at North Shore University and the creator of the PACO Foundation, Patient Awareness for Clotting Outcomes, dedicating to improving care around the world regarding blood clots. We're also very honored today to be able to present data from two past presentations by famous investigators, Professor Bikdeli from Harvard University. We're going to talk about COVID. I will put a link in here to his full presentation, which he gave for the PACO Foundation previous month. And then this last Saturday, Dr. Patel from Chicago gave a wonderful lecture on an update to the vaccines. There'll be a link to her complete talk. And finally, I will provide some updates and overview, putting all of this together. So with that introduction, let us start to talk about this very complex and nasty disease. First of all, an update on January 12th, there were 22.9 million cases in the United States. And you'll notice that was a 37% change over a 14-day period with 380,000 deaths. Now, compare that to February 11th, when we had worldwide 107 million cases with 2,366,000 deaths. But the United States went up from 380,000 to 471,000 deaths and almost 5 million more cases of COVID-19. The United States, India, Brazil have the most infected patients. Now, moving ahead to March 27th, now the coronaviruses in the United States have jumped another 3 million to 30 million, with the deaths now another 70 or 80,000 up to 560,000. And you'll notice there were 23,000 recovered. The day before I made this recording, there were 4,000 new cases in Chicago. Now, COVID-19 is a virus-induced inflammation which triggers a cytokine storm, causing tissue factor release, thrombin generation, and fibrin formation. So the clotting cascade gets involved early, and that produces this fibrin, and it's designed to cover the virus and prevent it from spreading. But unfortunately, there's some side effects. The first is thrombosis, and that's manifested by certain blood tests. A most important one is D-dimer. And then a variety of blood clotting abnormalities, thrombosis in the arteries, the veins, the lungs, the brain, and anywhere there's a lining of blood vessels, because that's where this virus attacks. The virus may involve small vessels as well as big vessels, and you may get organ insufficiency like kidney failure and so forth. Fibrinolysis is activated, the clot busting system of the body, because once the body starts to produce clots, then it tries to get rid of these clots. It's a normal mechanism, but that may lead to bleeding. And then if this really gets all out of whack with the most severe disease, then you can have what's called a DIC-like picture with blood clotting and thrombosis and bleeding all wrapped up into one. Now, this virus has a predilection for the lungs, and here you're looking at the beautiful alveolar-endothelial interface, where the blood and the lungs exchange oxygen and nutrients, and this is the secret of life. And this virus attacks this area preferentially, although other areas of lining of the blood vessels throughout the body. And as a result of that, there's an ACE2 receptor which facilitates the virus entering the endothelial cells. It's like a spike and an arrow that enters these cells and causes all of these reactions, as you can see listed on this page, to occur. And I would like to just summarize something that is very interesting to me, and it's a part of history. And this famous uh, hematologist, Oscar Radnoff, who, when he was born, by the way, in 1900, his father, who was a pediatrician too, was encouraged to let him die because he was low birth weight and so forth. But his father nursed him along, and lo and behold, Oscar became a very famous hematologist. He actually described with Dr. Davies the clotting cascade of how the clotting factors interact. And he also discovered in factor 12 deficiency called Hegemon factor in his patient, John Hegemon. And the proposal that he put together, the thesis, was that before the turn of the 20th century, if the Hegemon factor gets activated, the blood's clotting factor gets activated. Now, why would that be? For example, if there's a cut in a vessel and the blood flows out into the tissues, then that activates clotting. Hegemon factor, or the contact activating factor, starts that process. And what happens is that the platelets, the little bodies in the blood, all clump together. Coagulation factors are activated, so you get the conversion of fibrinogen to fibrin, the fibrin mesh. And then fibrinolysis occurs, because then the body starts to want to break up those clots. And that's where we see the D dimer that we can measure. But more importantly, the body's inflammatory systems are also activated with the activation of what's called complement and interleukin 6. And these are inflammatory markers and part of the cytokine storm. And in addition to that, the kallikrein system gets activated. And these are bradykinins that slow down the heart, PFDIL, which is a protein that causes the fluid to leak out of the blood vessels. You can have hypotension, shock, histamine release, and serotonin. And all of those things I just listed are typical of an antigen antibody reaction, like when you get a bee sting. But there's no antigen antibody reaction here. And this was the brilliant conclusion of Radnoff, that all of these things I just described to you happen by the activation of factor 12. Now let's roll ahead to today. COVID-19 is the tangled web, as Oscar Radnoff termed it, on steroids, where it magnifies all of these changes. And you get thrombosis, fibrinolysis, increased vascular permeability, vasodilatation, the blood vessels dilating, bradycardia, the heart slowing down, angioedema, histamine and serotonin release, and of course, low blood pressure. And these mechanisms are all interconnected. But we're seeing today, which is a little bit frustrating in a sense, is that doctors are looking at this from their own lens. The clotters are looking at platelets and coagulation. The inflammatory doctors are looking at inflammation, cytokine storm, IL-1, IL-6. And the immunologists are looking at the antigen antibody complexes and the bradykinins and so on and so forth. And here's what Oscar Radnoff said about that. The thesis of my talk is not new. We think about clotting, fibrinolysis, immune reactions, and inflammation as if they were separate and separable processes. In truth, these distinctions are man-made. In real life, it is the body as a whole that responds to the injury. The processes through which it defends itself are interlocked like pieces of a jigsaw puzzle. We may be intrigued by the intricate pieces of this puzzle, but the picture emerges only when they are put together. I'm finally now starting to see some interplay between all of these specialties, but this is one reason that focusing on anticoagulation alone is not the answer to either the prevention or treatment of this disease. Now let's take a look at what is happening right now, a very important National Institute of Health multi-platform. It's actually now been, the study's actually now been completed. And what it shows is that it was addressing anticoagulation, and anticoagulation has been a very, very contentious topic. And you know, all of us we see all these blood clots, so we want to increase the dose of anticoagulation to cause the blood clots, to control the blood clots, prevent the patients from dying. And it hasn't been the answer. And as a matter of fact, this big platform of thousands of patients has shown that in severe cases, defined as those in ICU, including those on the respirator, the thrombotic events between therapeutic anticoagulation and prophylactic anticoagulation were no different. The bleeding was higher with therapeutic anticoagulation, but the problem here is that giving everybody who goes to ICU full dose anticoagulation is certainly not the answer. Now, I would argue that there are certain patients that go to ICU with very specific abnormalities, active cancer, past history of thrombosis, elevated BMI. Maybe there's some patients that would benefit, but in general, they don't, according to this very well done study. On the other hand, patients who are in the hospital, but not in ICU, their need for organ support, giving them therapeutic anticoagulation, is much lower than if they were given prophylactic anticoagulation, which we call usual care. The mortality was lower giving full dose anticoagulation, and the thrombotic events were also lower. So, and the bleeding was a little bit higher, but it was in a 1.6%, very acceptable range. So that the NIH announced that full dose anticoagulation is superior to the usual care prophylactic dose anticoagulation in reducing the need for organ support and mortality in moderately ill, non-ICU hospitalized COVID-19 patients. Now, I would like to refer you to Dr. Bikdeli's lecture. We'll give you a link to that. He's a very famous Harvard professor, very well spoken and very nicely articulated in this lecture. It's well worth everybody listening to it if you really want to get more information regarding this aspect of COVID-19 after a year. Then it's my great pleasure to introduce all of you to Dr. Patel, who's the medical director of the Chronic Disease Prevention and Health Promotion for the Chicago Department of Public Health. In this role, she works on improving upstream health determinants across Chicago and oversees clinical programs sponsored and supported by the city of Chicago. She previously worked as an assistant professor at the University of Chicago and has her MD and MPH from Emory University. She's a very well-spoken individual that has a great deal of insight and information. Again, we'll give you the link to the full lecture. It's well worth looking at, especially for those of you that are in the Chicago area. And this is one of the slides that I have taken from her, just talking about the fact that there's 2 COVID-19 vaccines that have received emergency use authorization, and they are Pfizer and Moderna. Johnson & Johnson vaccine is anticipated to receive full authorization this week and is going to be shipping to the Chicago area. Pfizer and Moderna are messenger RNA vaccines, and Johnson & Johnson vaccine is an adenoviral DNA vaccine. All 3 work to tell your body to grow immunity to COVID-19. That's very important. None of these vaccines contain any dead viruses or any part of the infection. You can't get the infection from this virus, from this vaccine. And those of you that get ill, it's building up your immunity. So that's very important. Now, there has been a recent flood of stuff on the internet and on the news media about blood clots and vaccines. And this has all been in response to a very specific problem, VTIP, vaccine-induced prothrombotic immunity thrombocytopenia, following the AstraZeneca COVID-19 vaccination. None of the previous ones, it doesn't affect Moderna, it doesn't affect Pfizer, it doesn't affect Johnson & Johnson. This is just the AstraZeneca. And these symptoms usually occur 4 to 20 days after receiving the vaccine. They include a severe headache that does not go away, a seizure or difficulty moving part of your body, new blurry vision that does not go away, difficulty speaking or shortness of breath, chest or severe abdominal pain, or new severe swelling, pain, or color change of an arm or a leg. There have been no confirmed cases of VTIP with any of the other COVID vaccines. That's very important for you to remember. All of these vaccines that you go and get now are safe, and they're not associated with this syndrome. The reason why I'm discussing it is because with all of the news and all of the discussion of that, people may get confused and think somehow their Moderna or their Pfizer vaccine is implicated. It is not. Now, the researchers have found that infected individuals in Germany have antibodies that induce massive platelet activation, reducing the platelet count and causing thrombosis. Treatment involves using non-heparin anticoagulants, the so-called direct oral anticoagulants, fondaparinux, or high-dose intravenous immunoglobulin for life-threatening infections. Rare cases of cerebral sinus thrombosis, which is in the brain, and other thrombotic events have been reported in the UK, European Union, and Scandinavia. Usually they occur 40 to 20 days after vaccination. They're associated with a low platelet count, which we call in the medical parlance thrombocytopenia. And this reaction occurs anywhere from 1 in 125,000 to 1 in a million. Vaccination does not increase thrombosis risk and is safe. People with a personal or family history of thrombosis are not more likely to get a blood clot if they're vaccinated, since this VTIP is an immune reaction, has nothing to do specifically with a past history of thrombosis. The latest data indicate there have been 20 million vaccinated in the UK and the European Union with the AstraZeneca vaccine. Only 7 cases of blood clots in multiple blood vessels and 18 cases of cerebral venous thrombosis have been reported. The authorities do state that a causal link with the vaccine is not proven, but it's possible and deserves further analysis. The number of thrombotic events reported after vaccination was lower than expected in the general population. One of the reasons for a little bit concern here, though, is that people like Dr. Tafur and myself and Dr. Bikdeli, who see thousands of patients with blood clots, don't very often see cerebral sinus thrombosis. So this will require further studies. Now, Dr. Patel has talked to us about some very important things here. The vaccines do not cause long-term damage. There's no relationship between the vaccines and fertility. This is an internet rumor. The vaccines are not made from any part of people or animals. This is an unbelievably scientific manipulation of DNA and RNA that is way beyond what we have known in the past. The vaccines do not interact with human DNA in any way, and you cannot get COVID-19 from the vaccine. You can't get sick from the vaccine. If you have symptoms, the symptoms aren't coming from a latent COVID. They're coming from the body's reaction being unwell, and you're building immunity, and that takes resources from the body. And as a result of that, you may have symptoms. And so that's an important thing to remember. You're not going to get COVID from this. There've been now, what do we have since by March 27th of this year? There have been 136 million doses given. 89 million people have gotten at least one dose, and more than 48 million people in America are fully vaccinated. That represents about 15% of the total population. And just to remember, 1 out of every 5 adults has gotten vaccinated. This is really wonderful news and is going on at full steam right now as we speak. Now, for those of you in Chicago, more than 25% of Chicagoans have gotten a shot. And you can see that the first dose has been given to 679,000 people, and that again is 25% of the population. Fully vaccinated is 12.7%. So in conclusion, COVID-19 represents a complex infection involving multiple systems, including clotting, inflammatory, and immunologic pathways. Pulmonary thrombosis and alveolar-endothelial damage are prominent features of this disease, as well as arterial or venous thrombosis, which can occur anywhere. Vaccination is imperative to limit the spread of the disease and protect against severe infections and death. Do not be afraid to get the approved vaccines. They are very safe, they're effective. Adverse complications are extremely rare, and the VTIP complication that I presented only only is from the AstraZeneca, which is not approved. All of the approved vaccines are very safe and effective. So remember that, and please go out and get your vaccination, but don't relax your social distancing or masks. All of those things are important. And I would just like to finally say that in Chicago yesterday, there were 4,000 new cases reported. So we're not over this yet. So everybody needs to attend to all of these dictums that are coming out of the federal government and coming out of the CDC and so forth for the prevention of this disease. I'd like to thank you all very much for your attention. And again, as I say, please subscribe to my site. I take a great honor to be able to present to all of you, and I try to present the best and most updated information. Thank you very much, and have a great day.